Hey everybody, welcome back to the Therapy Guys channel. Hope you're having a great day. I am Dr. Tyler. This is my first appearance on the channel, so you'll get to know me a little bit. We have a new segment that we're going to do today with our good friend Mark. Mark has been a patient of ours since for a while, for about 5 months-ish.
Yeah, since December.
Yeah,
I've been here for a while.
For a while. And so what we're going to do today is we're going to go on this little adventure with Mark to talk about why he first came to therapy and kind of our procession or our progress in therapy, if you will, since that time. So Mark, give us a Reader's Digest version of why your initial injury, why we started with therapy, and then we'll just kind of go from there.
Sure. Well, I work for the city of Farmington. We were doing an inspection on a house. I had an accident at the house. Initially, it was my knee, my ankle, my hip, and then my lower back. So we started doing testing, and then they sent me here to physical therapy, and it wasn't really improving all that much. Still no pain, but no function either. So we, did the regular stuff, the exercises, the stretching. That helped a little bit. And then you came up with the idea of the dry needling.
Right.
And I had never had that before. I didn't know what to expect, but it worked wonders for me.
Right. So if we go back to kind of the beginning, I'm certified in McKenzie therapy, so direct mechanical diagnosis and treatment. When Mark came in, I definitely noticed that his gait pattern was way off. But I didn't know if that was because of pain, back pain, leg pain, things like that. So I started in my comfort zone doing a McKenzie evaluation. So we found that press-ups helped with the back pain. We pretty much got rid of the back pain.
Spine mobility.
Yeah,
exactly.
The mobility came back, but he still had this funky walk. And so I was thinking there has to be something neurological going on. Is it something in when he fell, did he jar something? Was there something going on in the lumbar spine? Fast forward like a couple months, they finally did an MRI on your back.
Yes.
The one on your low back, what did they find?
Nothing. That was completely negative. They didn't find anything wrong with that. They did my knee, nothing. Ankle, nothing. Low back, nothing. Mid back, nothing.
Right.
Neck, then we're just going right up the spine.
Right.
They did the neck, and then they found the hydrocephalus up in my brain.
Right.
So that's what the problem is.
And so at the time, when we found out that there was nothing wrong with his low back, I consulted with Dr. Wes, who you've seen on this channel do his magic dry needling. And I said, Wes, there's got to be something going on up higher in the chain. Like, it's not coming from his low back. I'm almost thinking with his gait pattern and everything, it's got to be something in the cerebellum, which is the part of our brain that controls all of our coordinated movements. Walking, especially in Mark's case, was way off. It wasn't working very well. And like Mark said, I had this crazy idea, and I consulted with Dr. West first to make sure that this is something that maybe would help. But I said, let's try some dry needling. And my theory behind doing that was, let's get the electrical stimulus into those glute muscles and into the back to see if maybe that coordination of movements would come back. I didn't know. It was just a theory. It was a hypothesis. Wes consented to do it. We did it the first time, and we had Mark walk, and I wish I would have filmed that. I didn't, but I wish I would have filmed that because we had him walk back and forth across our gym area. His gait was horrible. I think you were using...
I was using the cane.
Yeah, he's using a cane and leaning heavily on that cane. Almost needed like maybe a walker. Well, we did start with a walker at first, and then kind of got to a cane, but very unstable. We had Wes dry needle him right in the glutes, the low back, and do a circuit on that. And afterward, we had Mark get up and walk. And do you remember how that felt?
Oh yeah, I mean everything was unlocked. When I walked around, and still today, it feels like it's like in the mornings, like it's locked up. It takes time to get warm. And when I got up off that table after the dry needling, everything was warm, was ready to rock and roll. it was smooth. The action was smooth. I wasn't fighting myself.
Right.
So,
And I think that's what I noticed most as well, is it was almost like I told him, Mark, quit using, the front of your legs and use the back of your legs. And with that little cue, he took off walking, I would say probably, if we say when we started is 0% and after, dry needling or after the regular therapy, like you
Right.
said, I would say it was probably maybe 45% better. The pain was gone, but that ataxic gait was still there. After we dry needled him, I would say his gait probably improved 40%.
at least,
Yeah.
not better.
To probably like an 80-85% of a normal gait. We still have ataxic gait even after we've done this several times, but we wanted to show how this dry needling has helped Mark. Now, he mentioned the hydrocephalus. Was there a mass?
There is. There's still one in there. I'm awaiting surgery. So we'll see what happens after the surgery if it improves it that much more.
Right. And so the mass is in, I read his MRI report.
Third ventricle.
Yeah. And so it's called the tentorium cerebelli, which is part of the dura mater of the meninges, which separates the cerebellum and the temporal lobes. And I'm going to have to cheat. And what's the occipital, occipital lobe of the brain? There we go. It covers all of that. And so Mark's doctor asked him, Mark, how's your vision? I'm surprised you can see. What were some of the things that he said that he was surprised you could still do?
He was surprised that I was still able to communicate, clearly and concisely. He was amazed that I still had, good thought patterns and that I can still see. And I told him the only thing I really have problems with is my gait. Like my legs just do not work.
Right. And they got way better after the dry needling. So that's what we want to show you today is we'll film Mark walking before, dry needle him, and then show him walking afterwards. Now, I don't envision that we'll see as great of a change in his gait pattern as we did that first time. Like I said,
it has improved tenfold compared to what it was.
Like I said, I wish I had filmed that initial one because it was sweet. So we're going to get to the walking examination, and then we will go into the dry needling, and then we'll watch him walk again. So stay tuned. Okay, what we're looking at here is Mark's quality of gait, and you can see as he walks, he has a lot of upper trunk sway. His glutes are not stabilizing. You can almost see a little bit of a Trendelenburg gait, and then you don't see very much toe off on the right side, causing a limp. A little more background on the dry needling side of things. Our thoughts were, as we noticed Mark walking, he struggled to activate his glutes and his core muscles. When this happened, he had some hip dropping, otherwise known as a Trendelenburg gait. So our thought was, let's do as much as we can to get input to his glute muscles, which are supplied by the superior gluteal nerve. When we go all the way up to the spinal nerves, that's L4, 5, and S1, but primarily L5. So we went into his L5 multifidi as well. So now we've got input going to the L5 area, to the actual muscles, the glutes. So with the spinal nerve hopefully stimulated, the peripheral nerve, and then the muscle, we had a nice circuit going to try and get that muscle communicating with the brain to give it as much input as possible. So now as he walks and does normal daily tasks, he has those muscles helping him perform the jobs that he needs them to. As you can see, post-treatment, Mark has less of a trunk sway as he walks. His glutes are much more stable, allowing him a better base of support as he walks. Even if, as we look at the right side, he's starting to get some swing in that right leg as his gastroc fires. All right, everybody. So from our case study today, first off, I want to just thank Mark for coming on and being such a willing participant to let us dry needle his rear end to show you guys the effect that the dry needling has on his gait. Like I said before, I'm not real sure why exactly it works. Our hypothesis is that it's stimulating the tracts that go from the cerebellum down to the legs, and helping the body remember, oh, hey, I have some glutes that I can use to help me stabilize when I walk. I don't have to put, I can use those glutes to help me walk a little bit better. We hope you enjoyed this. It's a little bit different video, but we really enjoyed making it, and so did Joe. And thank you for watching. Remember to make sure that you subscribe to our channel, hit that like button, and give us some more ideas for content you'd like to see. We're all about the people and pleasing the people. So remember, hashtag keep yourself moving. I messed that up, but that's okay. Always keep moving, and we will see you guys in the next video.